Chapter 1, Episode 19. Yesterday we learned that there are 5 major types of viral hepatitis: A, B, C, D, and E. Today, we're focusing on hepatitis B and C. But why these two? Hepatitis B and C are especially important to long-term liver health because they can become chronic infections, lasting for years and potentially leading to serious liver damage. Hepatitis A and E usually cause short-term infections. Hepatitis D is different, it can only infect someone who also has hepatitis B. That's another reason understanding hepatitis B is so important. Here's the challenge: some people with chronic hepatitis B or C can feel perfectly healthy for years. So symptoms alone cannot tell you whether you're infected. If you develop unusual fatigue, dark urine, jaundice or pain in the upper right abdomen, talk with your healthcare professional. These symptoms can have many causes, but they may need investigation. Even without symptoms, your medical history and recognized risk factors may give your doctor a reason to recommend hepatitis testing. Your doctor may consider factors such as where you were born, previous blood or medical exposures, and other recognized risks when deciding whether hepatitis B or C testing is appropriate. And don't forget your family history. If a close family member had hepatitis, cirrhosis, or liver cancer, make sure your doctor knows. That information may help guide further assessment. Hepatitis B can be screened for with a blood test called the triple panel. It checks 3 markers: hepatitis B surface antigen, surface antibody, and core antibody. Together, these results can help determine whether you currently have hepatitis B, had an infection in the past, developed immunity through vaccination or recovery, or may still be susceptible. Hepatitis C uses a different blood testing pathway. It usually begins with an HCV antibody test. If that test is reactive, an HCV RNA test determines whether the virus is currently present. Remember Episode 17. ALT can show that liver cells may be injured, but ALT cannot diagnose hepatitis B or C. These specific hepatitis blood tests are looking for something different. Look through your previous blood test reports. Have you ever seen these names? If not, don't assume your hepatitis results were negative. These tests simply may never have been ordered. That's the key message: not tested does not mean negative. If you're unsure whether hepatitis screening is appropriate for you, ask your healthcare professional. Chronic hepatitis B or C can gradually damage the liver. In some people, years of injury can lead to fibrosis and eventually cirrhosis. Finding the infection gives doctors an opportunity to treat or monitor it. And there's encouraging news. Today's antiviral medicines can cure most hepatitis C infections. Chronic hepatitis B usually cannot yet be cured, but treatment can suppress the virus and reduce the risk of serious liver complications. So why is finding chronic liver disease so important? Some people develop a higher risk of liver cancer. In our next episode, we'll learn about AFP, a blood test used as part of liver cancer surveillance in certain higher-risk patients.